When you have kids, a really neat thing that you get to do is you get to take them to their well visits, and you get to see how much they've grown since their last visit, and you get to acknowledge all the milestones that they've met since the last time they visited. But sometimes these appointments don't go as planned. My name is Jennifer, and I'd like to tell you about Gaucher's disease. Gaucher's disease is a rare genetic disease that affects about 1 in every 40,000 live births. It is most common in people with Jewish Eastern European descent. If both parents are carriers of the gene, your child has a 1 in 4 chance of being born with the disease. I have 4 children. 2 of my children have the disease, and one of my children is a carrier, and the other child does not carry the gene. When my daughter was 2 years old, I brought her in. She was my 3rd child, and I brought her in for a well visit. I had noticed that she was tired. I had noticed some things here and there where things had gone along, but we always just dismissed it as the fact that she was the 3rd child, and she had 2 other kids doing things for her. But it was during this 2-year-old visit that we noticed that her spleen was large, and this was the beginning of a search for a diagnosis. Over the next 3 years, we met with several pediatric specialists, pediatric gastroenterologists, the Center for Children's Cancers and Blood Disorders, testing and looking and exploring and trying to figure out what was going on with her. We started with things as simple as mono, and then it moved into cancers and blood disorders. But she was continuing to grow, and she was continuing to develop, and for that we were thankful. It wasn't until we were about into the 3-year mark that my son, my oldest child, actually started breaking bones. And now that I look back in hindsight, as a baby, he had low iron and suffered from anemia. But it was then that we realized that there was something genetic going on. I was talking to my best friend from high school who actually worked for Genzyme, which was the company that found a treatment. She was working as an intern there about 25 years ago when she had first gotten out of college. She called me up and she said, "Jennifer, I really hope this isn't true, but I think your kids may have Gaucher's disease." I started reading about it and learning about it and became overwhelmed with it. I came to one of my doctors and I said, "Do you think they have Gaucher's disease?" And when she asked if we were European or had any Jewish descent, and neither their father nor I knew of any, it was simply dismissed. Fortunately, within the next few months, there was a family that moved from Texas to the Syracuse area and was actually referred to our pediatric gastroenterologist. And when the children and I were going up for our visit, our appointment was scheduled 1 week after he met them. Once he met them, he became aware of the disease. So when we walked into the office, he took one look at my children and said, "They have Gaucher's disease," and sent us right down to the genetics unit. And that's where we began testing, and that's when we began treatment. So Gaucher's disease, there's actually 3 different types. Type 1 is the most common type, and that's the type where cells build up in your liver and your spleen, and it's actually treatable. Like I said, an enzyme replacement therapy was actually developed within the last 30 years. They started working on it. Basically, you get IV infusions every 2 weeks, and what it does is it puts the enzyme that their bodies are missing to break down these Gaucher cells to prevent them from building up. A newer therapy was recently approved by the FDA within the last 5 or 6 years for the use on adults. It's a substrate reduction therapy, and it's basically just a pill that you take that prevents your body from even making these Gaucher cells. But at this time, it's only approved for use in adults. Type 2 is the other type, and this is a much more rare form of this gene mutation. It causes neurological abnormalities because the Gaucher cells actually build up in the brainstem. It's usually fatal within the first 2 years, and at this time there is no treatment for it. And then there's also type 3, which happens to be rare in the United States, but it's actually the most common worldwide. It varies in severity between type 1 and type 2, and there's a lifespan of about 50 years. There is some treatment available, but it doesn't work as well as it would with type 1. Symptoms that you'd see in Gaucher's disease would be a swollen belly. A swollen belly that is caused by the enlarged liver and spleen. There's bone pain and easy fractures and problems with osteoporosis, anemia and fatigue, as well as they tend to have low platelet counts, which leads to some bleeding issues and some bruising problems. Right now, living with Gaucher, I'm happy to report that my children are doing very well with their treatment. We do have to see a geneticist every 6 months. I have enrolled my children into a blind study where their notes and information is put in for research to hopefully eventually find a cure for this disease. We do biannual blood panels. Every other year there's MRIs done on different parts of the body, as well as ultrasounds. And then we do have an infusion nurse that now we no longer have to travel to Syracuse, but she actually comes into our home and spends about 6 hours with us every other week and does the infusion therapy. And I'm fortunate to say she's become like family. So that's a little bit about Gaucher and about a rare genetic disorder or disease. And I just wanted to thank you for taking the time to listen to this video. And then I also just wanted to remind you that, you never know what other people are facing, and just to always be kind. Thank you.